Ever had someone slowly back away mid-conversation? And you suspect it's not your punchline that's repelling them? Maybe it's your breath. Let's face it, we'd all prefer if our breath could smell like a bouquet of roses, or at least plain old nothing. But halitosis, the fancy term for bad breath, is actually one of the oldest complaints in human history. It's mentioned in ancient texts, like Greek, Roman, and Persian medicine sources. So if you sometimes wonder if your breath could peel paint, stick around, because today, we're going to explore the many causes of bad breath, how to prevent it, and how to treat it. Halitosis is more common than most people think. It affects around 30 to 50% of the population, depending on a community's general health culture. Here's the kicker. Often, the person with halitosis doesn't realize it at all. Meanwhile, everyone around them might be ready to pass out from the fumes. But don't worry, preventive medicine offers plenty of reliable solutions. Interestingly, some folks have the opposite problem. They're convinced they have horrible breath when they really don't. It's the ultimate plot twist. Your breath is fine, but your anxiety skyrockets for no reason. The first step to tackling halitosis? Ask someone you trust, a partner, a close friend, or a family member, for an honest answer. If you get a suspicious glance and a quick step back, you might have your diagnosis right there. A mild off odor in the morning isn't necessarily a big deal, by the way. It usually happens because your saliva production slows down at night. Eating breakfast and rinsing your mouth typically solves morning breath. But if you notice your breath taking a turn for the worse 2 or 3 hours after a meal, or even during meals, and it's enough to make folks around you recoil, that's a sign of a more persistent cause. It might be something in the mouth, throat, nose, esophagus, or stomach. And when your breath is hurting your social life or intimacy with your partner, it's time to do something about it. Bad breath can affect people of all ages. Parents, take note. Watch your kids' oral hygiene, and make sure they aren't strolling around with food particles in their teeth that would make a microbe's day. Let's break down some key points. Avoid sticky snacks. Chips, puffs, biscuits, and cakes can stick to gums and teeth long after the snack break is over. Microbes then convert these leftovers into acidic substances, damaging the gums and tooth enamel, which can lead to decay. And yes, halitosis. So if you or your kids indulge in these treats, rinse your mouth and brush your teeth afterward. Don't let microbes run wild. In unfavorable oral conditions, microbes can double in number every half hour. That's the kind of growth you'd want if you owned a bakery. Not so much in your mouth. Brushing and flossing after meals and rinsing or gargling can help prevent tooth decay and keep your breath fresh. Obesity and snoring. Carrying extra weight, especially if you have a short neck, increases the likelihood of snoring, mouth breathing, and dryness in the mouth. Less saliva means less natural cleaning, which equals a higher risk of halitosis. Plus, obesity can come with a lot of complications. Bad breath is just one of them. Allergic third tonsil, also known as adenoids, in children and adults. Enlarged adenoids can block your nose, forcing you to breathe through your mouth. This can lead to sinusitis, ear infections, and nasty discharge in the back of the throat, certainly not the perfume of choice. Rinsing the nose with saline solution and working with an ENT or pediatrician can help solve this. Gum problem and tooth decay. Two of the biggest culprits behind bad breath. If you're suspecting gum inflammation or decaying teeth, see a dentist. Trust me, your breath and the people around you will thank you. Tonsil stones, also known as tonsilloliths. Some people have naturally cryptic tonsils, which is basically a fancy way of saying tonsils with little pockets. Hard particles like nuts and seeds can get stuck in there. Bacteria then get to work, producing a cheese-like whitish substance that eventually hardens into tonsil stones. These stones are loaded with anaerobic bacteria like Eubacterium, Fusobacterium, Porphyromonas, Prevotella, Selenomonas, and Tannarella that pump out sulfur compounds, creating a very unappealing odor. If you have chronic tonsillitis or ongoing tonsil stone issues, you can often manage it with self-cleaning, gentle irrigation, and gargling with saline. If that doesn't help, an ENT's door is always open. No shocker here. Smoking dries out your mouth, inflames gums, and sets you on a shortcut to dental destruction and pungent breath. Quitting tobacco and taking proper care of your mouth can do wonders. Clean the tongue, especially the base. The back of your tongue can trap bacteria. Gently brush it or use a disinfecting mouthwash to keep that area from turning into a bacterial party zone. Check for serious conditions. If bad breath is accompanied by loss of appetite, weight loss, reflux, or difficulty swallowing, especially in older adults, then you should consider the possibility of more serious gastrointestinal issues. An urgent consult with a gastroenterologist may be necessary. Nasal saline rinse. If you have a stuffy nose, inhaling saline solution, particularly before bedtime, can reduce congestion, improve sinus drainage, and help you wake up with fresher breath. If the problem is severe, an ENT can guide you on further steps. Think about it. There's no better way to greet the world than with a confident smile and minty-fresh breath. So start simple, stay consistent, and if the problem persists, don't hesitate to reach out for professional help. Your nose, and everyone else's, will appreciate the effort. Please like and subscribe to receive more up-to-date tips on preventive medicine.